Well, kia ora, good morning. Thank you for your patience and thank you for being here this morning for this stand-up. We do have a further media briefing at 2:30 this afternoon, but I did want to do a specific shorter briefing this morning because I know there is a great deal of interest in the WHO announcement that they have declared a public health emergency of international concern. So you will be aware at about 8:30 this morning, the Director General of the WHO, Tedros, made an announcement about that decision based on advice from an ad hoc committee that has been convened specifically to address this issue of the novel coronavirus that originated in Wuhan. And WHO determined this on the basis of the emerging evidence and epidemiology, and in particular, and I want to quote from Tedros's statement, that he says, "We know what sort of damage this virus could do if it were to spread to a country with a..." And he goes on to say, "Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill-prepared to deal with it." So I just want to run you through the principal consequences of that decision, and in particular what they mean, if anything, for New Zealand. So the principal consequence is that the WHO Director General is able to formally issue temporary recommendations around this particular disease, the novel coronavirus, under the 2005 International Health Regulations. So the Emergency Committee provided specific advice to WHO, to China, and indeed to all countries, including New Zealand. The advice to all countries is that we should be prepared for containment, including active surveillance, that's essentially looking for cases, early detection, isolation, and case management, contact tracing, and prevention of onward spread of this novel infection. And this is important to share full data with WHO. So one of the key outcomes of this decision is that it effectively formalises the international cooperation, and it places a requirement on countries who are all signatories to the international health regulations to provide data to and report to WHO on their actions to help deal with it. The advice went on to say that countries should place particular emphasis on reducing human infection, prevention of secondary transmission and international spread, and contributing to the international response. Now, you will be aware that there has already been a large international global multi-country response, and that, in a sense, this announcement formalises that response and enables countries to support each other with the WHO. And of particular value is that it enables the World Health Organization to mobilise resources to support low-income countries or countries with less well-developed health systems. And that's very important because the international global response does require all countries to cooperate and to act together. There's a specific recommendation about travel, and the advice says countries must inform the WHO about any travel measures taken as required by the international health regulations. Countries are cautioned against actions that promote stigma or discrimination in line with the principles of Article 3 of the IHR. And so in his statement, the WHO Director General did say that there is no reason for measures that unnecessarily interfere with international travel and trade, and WHO doesn't recommend limiting trade and movement. The Director General did go on to say, of course, that countries are able to make their own decisions as part of their evidence-based response, but they will need to explain the basis of those decisions around travel and trade to the WHO. That's an obligation under the international health regulations. So just before I move on to two other matters, I just want to point you towards that statement. It's on the WHO website. It's a very clear statement from the WHO Director General, and I think very helpful. And what it does emphasise and endorse is the approach that New Zealand has taken to date. We have acted very much in line with the WHO advice and will continue to do so in accordance with our very well-developed pandemic plan. The National Health Coordination Centre here in the basement of the Ministry continues to monitor the domestic and international situation closely, and we will be continually reviewing and adjusting our actions and advice to agencies regularly as the situation evolves. The other main point I wanted to make was that I can now confirm that there is testing available in New Zealand, so a media statement will have been going out from ESR presently to confirm that they can now test for this virus in New Zealand. The turnaround time is relatively quick, a matter of a few hours, and they will be running a batch of these tests each day, once a day, which is very normal in this situation because the numbers are small, and supporting other laboratories who may be setting up that testing as well. Just to confirm that there is a further media stand-up at 2:30 this afternoon, and before that there will be a meeting of the ODESC, which is the Officials Domestic and External Security Committee, being convened. So I will be able to report any feedback from that committee and any key decisions and advice as well at that subsequent media stand-up. So I'll pause my comments there, and I'm happy to take questions.
Given the determination from the World Health Organization, are we going to be changing any of our airport measures? Will there be any additional measures at borders?
No, we won't be changing any at this point in time, and as we have over the last week or two, we'll be updating our advice and reconsidering that on a daily basis. At this point, we'll leave the same measures in place.
So you won't be meeting any other flights of, say, people who have transited through China or anything like that?
No, not at this point. And whilst the WHO declaration is important in that consideration, more important is what's happening around the epidemiology, the spread in countries outside of China. And the WHO Director General again emphasised that around 99% of cases are still in China. And whilst we now have 18 countries with cases, and I think the number is 98 in other countries, of which there has been human-to-human transmission in 4, it's still a very low number of cases in countries outside of China.
What about in the community? Are there any steps, not necessarily the board, but are there any steps of things that you're doing as a result of this declaration more generally in response to the declaration?
Not specifically to the direct declaration, but I would point to the advice that we gave yesterday, which remains the same today, that anyone who has travelled to Wuhan or the Hubei province in the last 14 days should self-isolate for the balance of that 14-day period, just on the basis that there is some small amount of evidence that people may be able to transmit the virus before they are symptomatic.
What about mainland China more generally? I spoke to someone who just made a decision to self-isolate after they've kind of gone through a major airport there where there are some cases in that city. And they went on the Ministry of Health website and it wasn't entirely clear, what they should do. Or they didn't think it was entirely clear what they should do. And they decided to self-isolate. What about advice for people that have, because, the virus is in lots of other parts of China?
Yes, the virus is widespread in China now, and that's something we're not advising people who have travelled to other parts of China to self-isolate. So saying, it's a personal decision and people may wish to do that, but that is an area that if you look in our updated advice that's due out soon, we've got that under daily review.
Okay. In terms of that World Health Organization announcement talking about the stop of the spread to countries with weaker health systems, say countries in the Pacific, is there anything that New Zealand is doing to look at our Pacific neighbours, either in terms of stopping flights or offering any support?
I can say we've been actively looking at that for more than a week, and our Foreign Affairs team have been engaging with Pacific countries through a specific mechanism that exists that involves the WHO and the South Pacific Community, SPC. And so we're actively reaching out and looking to support countries. There is another element to that too, and you will have seen that in the Minister of Foreign Affairs announcements. He's talked about the mission that's been organised to go and pick up New Zealanders in Wuhan will look to include people from Pacific countries to be in any of the seats that may not be occupied. So we're actively looking at that and very conscious of both our obligations and also our interest in supporting our Pacific neighbours.
How concerned should Kiwis be at this point?
No more concerned than they were yesterday. I think it's right that we've got, and I said this morning in an interview, we are concerned but not alarmed. So we're concerned, and that means we're taking a precautionary approach. There's nothing in particular in the WHO announcement that raises our level of concern or our assessment of the risk here.
So alert but not alarmed is still your line.
Indeed.
Just back talking about the Pacific, you spoke about the support to Pacific neighbours, but in terms of meeting flights, screening people coming off those flights from Pacific, is there anything happening there?
Nothing at the moment, just the flights from China. You will have seen the Samoan government last week made its own decision around the requirements on people travelling into Samoa, and that's a decision they took. And of course, we're supporting that from our end as we can.
Could you tell us more about the testing kit? Who will be tested? How many people per day, and how that will be reported back?
So on the ministry's website is a very clear case definition of a suspect case, and it will be all those people will be tested, and anyone who perhaps doesn't necessarily directly fulfill that case definition, but it's just something to be ruled out. Now, as of yesterday afternoon, about 5 people had been tested. None of those tests were positive, and in fact, none of those people fulfilled the suspect case definition. So there will be, I would imagine at this point, a handful of tests a day being done, and we will, of course, get the results back quickly. And as we committed to yesterday, and you heard the Minister of Health, Dr David Clark, say this, we will let the public know as soon as we have a confirmed case.
What difference does this make for travellers, like practically going to China and coming to New Zealand?
Nothing has changed, and I just point again to the WHO advice that they're not recommending any restrictions on travel or trade, and so people should make their own decisions. My understanding is that New Zealand, very consistent with a number of other countries, on their Safe Travel website, is advising people not to travel to China unless it's really important.
Obviously, it's not at this stage yet. You're still, allowing that travel. What types of considerations do you make when you're deciding whether or not to stop flights or close the border to any flights that come from China?
Well, obviously, we look first of all to what the WHO advises and its evidence-based recommendations. Secondly, we have been working very closely and in step with Australia. And you will imagine there are good reasons for that. And there's a very strong exchange of information in both directions. And a key input, of course, third to our decision is just what's happening with the epidemiology of this outbreak, the number of cases there are in countries outside of China, and also the extent of any person-to-person transmission in countries outside of China. So those are some of the factors we'll be looking at.
There was obviously reports again this morning of human transmission in the US. Does that kind of elevate the concern at all in your mind, or is that just what it's saying?
I think it's the fourth country. We were on 2 or 3. We've now got 4. Still a relatively low number of countries and low number of instances of human-to-human transmission. I think a total of 8 cases. And in what it does really show is that countries with well-developed health systems that are able to identify cases early, isolate and contact trace are really look to be able to prevent further transmission and certainly prevent any community outbreaks. Perhaps time for one more question at this point.
So we've got Winston Peters saying that plane's ready to go, it's barring clearance, and then you're saying we don't actually know where we're going to put the travellers when they come back. So what's going on there? Has there been any update on what you're actually going to do?
We've given advice to the government on options for what to do with people when they come back, and I can tell you the team's working very hard with a range of other government organisations, and when all the decisions have been taken, the government will announce what the full package is.
But we still don't know yet what will happen to those people.
That's all under consideration. I can't comment any more at the moment on that.
Can you comment on that advice that you've given, outline broadly what it's been?
Because it's under consideration, I don't want to say anything more about that just at the moment, but the government will make an announcement as soon as decisions have been taken.
Have you been given an idea of when that announcement will be made?
I haven't, and you will hear more, I'm sure. Thank you very much for being here, and I hope I can see you also this afternoon when we will update you on any further developments. Thank you very much again.